So, everybody, I think what's happened, especially from January this year, with Trump's arrival, is that I think last year, this time, the word transgender, most people, if you would even use the word transgender or gender affirmation, you would get, there's a lot of people that wasn't even aware of the term. And Trump has made the whole world aware of transgender people and not in a great way. And this extreme persecution of transgender communities and societies. But actually, when we look at gender affirming care in South Africa, it's already something that's very much embedded and part of our vision of ensuring care for all kinds of populations in South Africa. And so I just want to actually show you what is happening. And because it's such a small population, many people, I think most healthcare workers, are not actually aware of the fact that we do have within the Department of Health and active policies working towards providing care for transgender and gender diverse people. So, if we just think in terms of South Africa, we are this massive country with all these different provinces. But if you actually look within gender affirming healthcare within government, there's been two trans-specific clinics. The well-known one is the one in Cape Town in Groote Schuur. There's been just two or three sites that actually done any gender-affirming surgery, and some of them has got like waiting lists of 20 years. This is in government. There's been access to hormones in theory, in terms of our tertiary EML. I'll show you a little bit about that. And we are hopefully providing mental health care to our transgender patients, but you can see actual trans services, very few in government care. And in private healthcare, obviously there will be more healthcare workers available that does this kind of care, but most medical aids, gender affirming healthcare is not included. The tragedy this year was in January when Trump and them shut down the PEPFAR, and nine of the main sites across the country that was providing the services in conjunction with the Department of Health. So we had MOUs with both WITS and Aurum to provide services. All of those clinics were shut down very, very abruptly. And by the end of March, they were all gone, and it's left a major gap, which is one of the reasons why we're having this training. So just to look a little bit in terms of, quite often we're thinking now in terms of trans people's access to hormones, but actually the issue is much bigger than that. And the big worry is actually transgender people accessing healthcare at all. So there's an amazing document called the RETIDSE State of Healthcare of Key Populations that comes out every year. This particular project is also currently under threat from a funding point of view. They combine various research organizations, a treatment action campaign, various advocacy organizations, and every year they look at the whole range of key populations and they sample primary healthcare facilities across South Africa and do a survey to find out how the experiences of key populations in our facilities. So this is Department of Health. And this is just what I've taken out from the 2024 report that was specific to our trans people. So only 35% of trans people said staff were always friendly at the facility. 61% of trans people did not think their privacy was well respected. Only 7% of trans people felt very safe or comfortable at a facility. Very worryingly is that 10% of trans people had actually been denied treatment, HIV treatment in the past year before that. And 72% of trans people who are no longer getting services at a public health facility reports the staff as the main reason. And the challenge is it's not that staff, generally healthcare workers, are always horrible to trans people, but it literally just takes one person. It takes one nasty security guard or one nurse that asks a weird question or one doctor that refuses to provide care, and then they become very, very frightened of going to our facilities at all. And so one of the key challenges in actually providing any kind of healthcare to our transgender and gender diverse people is they do not feel safe to come to our facilities. So this has been recognized, and one of the effects of this is actually that we're seeing a much higher risk of HIV, especially in our trans women. And this is largely due to the fact that they're not accessing HIV testing, condoms, prevention, PrEP, etc. So the Department of Health has a program called the Key Populations Program, and they've recognized specific groups as being more vulnerable. And a lot of this has to do with actually just access to care. So obviously it's our gay men and men who have sex with men, our transgender population, which is what we're focusing on today, sex workers, drug users, and prisoners. So there's always a little bit of pain that the program that's looking after transgender people is directly falling under the HIV strategy. But that's a little bit how public health works. That's where the interest lies. And so, yes, the key population program falls under the National Strategic Plan for HIV, STIs, and TB. And this provides a framework for us providing care for transgender people. So I'll just show you that NSP, and it has very specific goals. So goal one is specifically around reducing stigma and discrimination. And it talks about reforming law and policy provisions to enhance access to gender-affirming healthcare. So that's one of the goals in the NSP. And then under goal three, there's particularly talking about building systems. And I just want to show you some of the breakdown with this. So this is under goal one, for example, when they were talking about how do we create systems. And you can see the number of departments. It's very across the different sectors that needs to be involved. But this includes updating our Alteration of Sex Description and Sex Status Act, talking about mental health services, talking about school retention. There's particularly looking at creating transgender-friendly facilities. So this is talking again about that issue around bathrooms, sensitization packages also in our traditional and spiritual leadership, legal literacy for transgender people. And then very much this intensify interventions to decrease primary, secondary, and internalized stigma through sensitization of service providers. So this is one of the reasons why we are here today as well. And very important is that we want to involve transgender people when creating these curricula. So this is under goal three, and under goal three, very practically, we are aiming to have gender-affirming packages at all levels of care. So these services need to be available. And even if you don't necessarily have hormone provision in your particular facility, we're more looking at a district sort of centralized program. You need to at least make sure that your own facility is transgender friendly. So if you've got a transgender patient who also has diabetes or HIV and has to get care, that we're at least creating affirming services for those people. So the key population program has actually already been under the previous NSP. This NSP is for 2023 to 2028, but it's been around for some time. And so under the previous NSP, one of the key tasks out of that was having gender-affirming hormones approved in our EML. So the transgender program initially used to be run through places like the Groote endocrinology unit. And so the first EML where this was included was in the tertiary and quaternary EML. And this is problematic, and we'll talk quite a lot about this, because the reason why we want transgender people to come to our facilities is so we can help them with prevention and their basic health care, and that needs to happen in a primary healthcare package. So at the moment, this is out of our tertiary EML. You can see that both estrogen and testosterone is approved specifically for gender dysphoria. And an application in February has gone in to have the medicines also available on a primary and hospital level. But I'll show you in a moment what that will look like. So to be able to support this process, the government has been using both NGOs and sort of leaders in the field to help them with various guidelines. And so for transgender care, the South African HIV Clinician Society stepped into that gap, and together with the Department of Health and under the Key Population Program, they wrote our guidelines. So we have a gender-affirming healthcare guideline for South Africa. And I just want to show you this extraordinary list of the team of people who were involved in this. And I think what makes this team particularly extraordinary is that these are not just doctors, these are interprofessionals. So we have psychologists, we have social workers, we have people from all specialities, psychiatry, endocrinology, family medicine. So there was an extraordinary working together across the different multidisciplinary teams to actually create this guideline. The other thing that's particularly, and this is, I think, what's becoming more and more important in our modern or our more recent guidelines on all the key populations, is the very importance, there's nothing about us without us. And so involving community-based organizations. I think we've really learned from the treatment action campaign during the HIV years. Our clients and patients need to be involved and need to have a voice when we are making plans on what to do and to how to help them. And so there's many organizations that also endorsed and supported this guideline. So the gender-affirming healthcare guideline provides evidence-informed best practice recommendations to enable South African healthcare providers, so that's all of you guys, and it includes psychosocial and the allied healthcare professionals to offer quality-affirming services to transgender and gender-diverse clients. What's lovely about the guideline, I love this. The first chapter's got a whole section of values. We don't have a lot of values listed in our other guidelines, but because it's so very closely linked to sexual and reproductive health rights, actually, it is very important to also be clear about the principles that underlies it. This is just very briefly to show you all the kinds of things that are covered within those guidelines. And in that pack that we'll send you guys, we will send you the guidelines. They're also easy to find on the HIV Clinician Society website. But I just want to show you that actually in the appendix, for those of you who might actually get to the point of prescribing, they actually have home affair letter templates. They've got information leaflets that I use all the time, and they've got lists of community resources. So when we talk about gender affirmation and within the guidelines, this is straight off that guidelines, there are 4 different areas we actually speak to, and Pierre already actually briefly highlighted those. And so just to realize, quite often when we talk about gender affirmation, everybody visualizes surgery. And some people might visualize hormones. But actually 95% of the time when we're talking about wanting affirming healthcare practitioners, we're actually talking about the social domain, which is literally just using the right pronouns, using the name that the patient prefers, and then allowing them to express themselves. So this becomes important, for example, in a school or a work setting where they're allowed to wear the clothes that they feel comfortable in terms of expressing their gender. And this is, it's such a simple thing to do, really, and it makes such a difference in those in their lives. Psychological is largely also talking about, and for those of you that are psychologists or social workers, is making sure that we've got trans-competent mental health care, and being able to understand the issues that clients face. The legal area is a large area, and it's very important to note that in South Africa, it is legal to be trans, including the fact that you can change your gender marker in your ID. At the moment, the ID only has options for male and female, and that's the reason why they want to update the act for our non-binary people to have a third option. I think it's making everybody scratches their heads, because for those of you that know, your gender is actually indicated by a specific number in your ID number. So that's causing a little bit of headache for Home Affairs, and they haven't quite figured that out yet. But also our anti-discrimination legislation talks to that. Very important in South Africa, they have a right to autonomy and self-determination. They can certainly say who they are, what they'd like to be called, and how they would like to be treated. We're obviously interested very much in the medical side, and I just want to show you all the different components of gender-affirming healthcare. So very important is primary and preventative care almost makes up the biggest section of that. So as with all of our patients, they obviously need their normal support for things like sexual health and cancer screening and STI screening and HIV prevention. But they're also quite a vulnerable group, specifically around a lot of the stigma and challenges they are facing in society. And so particularly having ability to actually provide also mental health care and support is very important. So there's your psychosocial care, and then medical therapy. That's very much that focus on that hormones to either masculinize or feminize. We're really going to delve into that next week. And gender affirming surgery, as I said, is not very often. It's also not automatic that all people who are trans will either want to go through medical therapy or gender affirming surgery. So it's a very individual journey on what people need to be able to feel comfortable within their bodies. But there's also all kinds of other things. So, for example, voice and communication therapy, especially for our trans women. One of the things that the hormones cannot change is the depth of the voice. And so our speech therapist has got an important role here in supporting that. There's also hair removal for our trans women, for example. There's some non-medical gender affirming practices, and we actually, our last little session today, Pia is going to talk to us a little bit about things like binding, tucking, padding, and packing and what you need to know. And then peer support groups that are affirming and helpful in society, very important. And these groups very powerful on WhatsApp, because the challenges with transgender is because they're relatively small percentage of people and they pretty much uniformly spread out in terms of when they grow up. You'll normally find that in each school or in each little community, there'll be a handful of people. And so actually having social platforms where people can actually build community has been very important in that section. So the other big guideline that is also providing guidance is the Psychological Society of South Africa guideline. This is this practice guideline for psychology professionals. It's a second edition, but it's literally come out in 2025. That's the gorgeous group that helped to create this guideline, and it's for working with sexually and gender diverse people. So for those of you that are also psychologists, social workers, psychiatrists, this is a document definitely worthwhile looking at. I'm going to quickly show you, just highlight headline for you, this fun stuff that's in it. And then next week, when we have our breakout rooms, the mental health group will specifically work into this into a little bit more depth. But these are the kinds of principles that comes out there. So adopting an affirmative stance, ensuring non-discrimination, upholding individual self-determination, I can't read the top bit because my Zoom's in the way. There we go. Recognize normative context. And so the world we live in quite often treats everybody as if they are, apologies, as if they are heteronormative. And how do we create societies that, or spaces which is not always heteronormative? Understanding intersecting discriminations. We're going to talk a little bit about that when I talk about ethics. Actively counteracting stigma, prejudice, and violence. Recognizing the multiple developmental pathways there are, even with the trans people, every one of their journeys are quite different. Very important is supporting diverse family structures and relationships around these people, and increasing social supports and foster resilience by prioritizing relational well-being and good relationships. So these are all actually all very sensible generally in looking after human beings. And I sometimes think that for me, the providing care for transgender people is the next frontier in terms of us remembering how to actually provide affirming care for all our patients, because all of these principles are actually important for all the human beings that we see. Oh, and look, there's three more, apologies. So affirming diversity, disclosing and rectifying personal biases, and enhancing practice through continuous professional development, which is what we're doing today. So I'm just going to give a last few slides to show you some of the other major key stakeholders. So this was sort of the Department of Health structure within the country. And there are quite a lot of advocacy organizations that are actively involved in actually building support for our trans communities, but particularly giving a voice to our trans community. So again, it's been the same challenge. And we saw that when Trump was coming out, and the same with the UK with J.K. Rowling and them. So there's some very powerful people who are very much driving this narrative that there is a binary, and if you're not in the binary, then there clearly must be something wrong with you, and trying to make it either criminalize it or pathologize it. And the problem is that to fight that is extremely hard because it's such a handful of people. So you have people that are very vulnerable and very few. And these organizations has been absolutely essential in providing some sort of voice for our transgender communities and the allies around them. So in 2020, the Professional Association of Transgender Health was formed for South Africa. So that's PATHSA. At the moment, Prof. Elma de Vries is the chair. She's a family physician who's in charge of the medical school, or in charge of the medical program of the new medical school in GAHC, and has been providing extraordinary leadership in helping to provide a professionalization for those of us working in gender-affirming healthcare. So basically, it's also interprofessional, which is awesome. So we have psychologists, social workers, speech therapists, doctors, and both the public and private sector provides some CPD and ongoing training. But I think more importantly, it provides some support for us as well as healthcare clinicians, because similarly, I am literally the only person in the public sector prescribing hormones pretty much almost in the entire Eastern Cape. So one can end up feeling very isolated, and being able to find yeah, other professionals in that realm. So again, if you are somebody that are interested to actually really get your teeth into this particular area, we would really encourage you to join PATHSA. It's like $400 a year or something. And please join our community in terms of providing some sort of community of practice. This is just some of the just shows you what we are actually all about, and it's to promote the health, well-being, and self-actualization of trans and gender diverse people. And we're really looking at best practices. We're looking very much at evidence, advocacy, and developing awareness around this community. So this is some of the things that's come out. This is from the Psychology Association of Psychology Society of South Africa. One of the challenges that's happened both in the world, well, in the world of LGBTQIA plus in general, is that under homosexuality, for example, was also originally called a pathology. And you'd probably be aware, like as little as 70, 80 years ago, they would give people hormones. They would give people, do electroshock therapy to try and fix their homosexuality or fix their transness. And this has become a little bit more subtle now, and a lot of stuff happening through both churches as well as some psychologists who actively promote and helping you fix you of your particular orientation or identity. The challenge with this is, and this has already been identified, for example, in America, they've actually banned conversion practices, and this is something that we're advocating for in South Africa, because conversion practices is a much higher risk of suicide. So unfortunately, if you're taking somebody who has a very strong inner experience and you try and explain to them that this is not the way they're supposed to experience the world, that can be extraordinarily dissonant and has risk to mental health. So now there's actually a toolkit for those of you, again, that's in the world of psychology, to work with survivors of conversion practices. So people who have been, and quite often they might even volunteer themselves if they come out of a community or out of a particular cultural or religious background where this is taboo. They might be desperate to try and fix these inner experiences that they have, and that can potentially lead to quite severe trauma and needs some help and support. So look out for that. There's also a training manual specifically for gender-based violence. So one of the challenges is that, for example, we still see corrective rape, for example, of lesbian women. But quite often you can imagine how traumatizing it must be for a trans man, for example, that may have been raped and now goes to a Tutuzela center and we meet practitioners who are not affirming and not understanding of their particular identity and reality. And then also we have also seen a lot of trauma in the transgender community due to this extraordinary anti-trans disinformation that's going around. So although a lot of this is being produced by the UK and by the USA, we are finding that, of course, all these narratives are coming over on social media. It's certainly influencing a lot of social media posts. And this is traumatizing. So for you as a young person who is transgender and is continuously on social media, continually being told that you are invalid, that you are immoral, that you are criminal, that there is something wrong with you. And this causes in itself also a lot of trauma and a lot of stigmatization. So there's actually been a need to look at our evidence and to actually provide guidance to support and how do we deal with all this anti-trans disinformation that is coming through. So a few position statements that's come out as a result is, for example, this is from PSA. So this was particularly around, apologies. So in South Africa, we have also actively looking at wanting to bring awareness to the harms and the risks of conversion practices. And then and partly in response already in 2024, this is even before this year, that a group of organizations came together and brought out a statement around embracing diversity, upholding rights, and around evidence-based care for transgender and gender diverse young people. Because of this attack, there's a huge drive from specific sectors that want to prevent any form of gender affirmation for youth and adults. And that includes just that social affirmation that we've been talking about. And then PATHSA this year, these are recent, after Trump's declaration. And then in the UK, the UK Supreme Court had this ruling that there are only two sexes, which becomes very problematic. And then this has also been endorsed by Helen Zille here in South Africa. So we've had to bring out our own replies, again, trying to give a voice to this very small transgender community that's being very actively persecuted by very powerful people. And so we're seeing how we can support our community. So that gives you a little bit of a, oh, and we're doing well on time. That gives us a little bit of a overview of what is actually happening. Maybe because we do have 5 minutes.